Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and welcome to the Simply Health Podcast. Thanks for joining me on the drive today. And today we're going to be talking about heavy periods during perimenopause. So for a lot of patients, I find that their concern is that their periods are getting heavier and heavier and more uncomfortable. And the thing is with mainstream is they don't really do too much about this. Otherwise, there's medications that they can give you to reduce the bleeding or offer a hysterectomy. And that's not necessarily the way that people want to go. So in terms of addressing this underlying cause, it's addressing this estrogen dominance. And estrogen dominance is like a two-headed beast. There's the estrogen aspect of it, which is often a little bit too high. And then there's the progesterone part of it, which is the balancing part with the estrogen, and it's often too low. So by correcting both of those, that is how we receive results. So the first thing you can start with is typically a very simple blood test at a specific time of your cycle, generally looking at around, you can actually check this twice if you want, during the period and then also at around day 22 to day 24 of your cycle. And the main thing you want to do initially for this is once you get the results, review them, but generally speaking, if there's excess estrogen during this time, you're going to want to do something to decrease that. And the best thing for this are products that have I3C or DIM extracts. These help your body detoxify any excess estrogen and estrogen metabolites. And in doing so, that alone, you can see a relatively quick change in your symptoms. So we use a product called Estrodom, or also called, we have a second one called Hormone Balance Effects. This works great for detoxifying this. The nice thing is it's usually only one capsule a day, and in extreme cases, sometimes we've had to go up to 2 capsules a day, but it's a very simple add-on. The next thing you want to do is that ask yourself, why is there excess estrogen? And a lot of times, if you're dealing with problems with weight loss, or I should say that you're more having difficulty with weight gain, getting this weight off can play a big role because estrogen is stored in the fat tissue and even produced by fat tissue. So by helping your body lose that will be very helpful. So and the best way to do that is a low-carb diet. And the reason that is, in this case, is that anytime you're getting excess sugars and excess carbs, it's causing a spike in insulin, which is causing your body to dump even more estrogen into the system, even furthering the estrogen dominance. So you switch to a low-carb diet, and you can learn more about this at ablehealth.us if you want to learn about that, or you can contact me. The low-carb diet for weight loss done properly works wonders. And I like to combine that when possible with a little bit of an anti-inflammatory twist to get all the benefits. And then we move on to point number 3, which is the progesterone balance. If for the progesterone, when we check that test, if it's really low and you're in the later stages of perimenopause, then it makes sense that you actually use a progesterone supplement, which is typically like a cream. A progesterone cream. This is a bioidentical progesterone cream you would put on your arm before bed. And if you still have a cycle, you're not doing this every day. You're doing it around day 14 of your cycle and then continuing that until your period starts. And then that can help quite a bit with the symptoms and relatively quickly, often within the first cycle of use. If your progesterone levels are showing us that they're completely normal, then you can use and add to that herbal formula and add herbs like Diascorea and Vitex, and this can help with your body's utilization of progesterone. So those would be the 2 options depending on what your progesterone levels are. Fourth thing to consider is that while you're waiting for the hormones to get balanced, is that there are natural remedies that you can use to reduce the heavy bleeding, and I've found in practice that when you use them properly, it can reduce the bleeding by 50%. According to most of my clients, their response. So the best time is that you would, and to simplify things, you really want to keep things simple, because the last thing we want to do is get into a situation where you've got like 20 different supplements going on. So the way it works is this. When you have your period, you stop everything, except for you take this formula for heavy bleeding. And that's often a mixture of different herbs, such as yarrow would be one, shepherd's purse would be another, panax noto, different blends of these herbs, and they can really reduce heavy bleeding. So we put that together in a formula, and then when your period's done, you stop that, put it on the shelf, leave it for the next month, and then you go back to your hormone balance remedies such as the DIM extracts, sometimes the progesterone, all depending on what your results and symptoms suggest. The fifth thing you want to consider, and this is where getting your MD's help can be really helpful, is that if the periods are really, really heavy and really, really painful, it's a good idea to get an ultrasound done just to make sure that you don't also have fibroids. Because if you do have large fibroids contributing to this, you can still treat it naturally, but it's a slightly different treatment approach and a different herbal formula. So then you'd be using herbs like Dong Quai, Black Cohosh, Bupleurum, Peony, and combining that with an acupuncture protocol. And typically to correct fibroids, if you're going to do it naturally, it's usually a 6-month window. And it's one of those situations where if it's going to work, within 6 months you're going to see the change. If you don't see the change within 6 months, then you might have to look into a little bit more involved interventions for it. But generally speaking, if you're going to see results for that, it's a 6-month window. So just to review, you're getting these heavy periods, it's starting to perimenopause, you don't want to have to take a lot of medications, you don't want to get a hysterectomy, so you're going to balance the hormones. If needed, you can do a lower carb diet to help with weight loss. You can do something to manage the symptoms with a simple herbal formula that you take just during your period. And then if you're not seeing the results that you're looking for within 2 to 3 cycles, at that point consider getting another ultrasound done or something to see if there are any fibroids, if you're not aware of that. So you could, now sometimes you could like, well, I'm just going to wait for menopause and this will all pass on its own. That can take a long time for some people. Like the perimenopausal time frame, especially with symptoms, can drag on for years. So you might not want to deal with that for years on end, given the discomfort and the blood loss and the low iron and low energy, which can lead to muscle pain and thyroid issues and all these other issues. So it's a good idea not to wait if you don't have to. And then hysterectomy is always an option. So I'm not saying that that's not an option, but a lot of times people are not looking for a surgical intervention, especially if it's very early on, because once you get that done, then your hormones are just going to go into a real down spiral after that. And while we can work to balance that, it just complicates it that much more. So just consider these different options. Whatever you do, even if you do decide to do a hysterectomy as opposed to just treating it naturally from the start, you will want to be working with someone to help with hormone balance after that, because once you get the hysterectomy done, even when they leave the ovaries in, it does compromise the blood flow to the ovaries, and you will see a fast decline in your hormones at that time that you would want to match. So you'd want to match that decline with the use of some bioidentical hormones to prevent from really early onset menopause and then the problems associated with that. So I hope this was helpful with the ramble today to give you a little bit of information about how, yes, you can deal with this naturally. You can get great results with this naturally, and there are a lot of options. So I hope this was informative, helpful, and this is Doc Yates signing off on the drive today. Thanks for listening. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.